So we are going to learn about pharmacology. What is pharmacology? Pharma means drugs and logy means study. So the study of drugs is known as pharmacology. Now what are drugs? So any substance which is used or intended to be used for exploring physiological and pathological causes in our body for the ease of the patient, not the patient, recipient. This is the normal definition of drugs that you have to remember. What is drug? If it is asked, you have to write the definition. It comes in your short note. So please remember what is drugs. Now, as we have learned about drugs, that it is any substance which is intended to be or it is used for exploring physiological and pathological aspect of our body. What may be the example of drugs in general life? We do use, if we get fever, we definitely directly reach to paracetamol. If we have cough with running nose, we use we use Montelukast. If we have cough, we use cough syrup. And many other. If we have burns or if we want to eradicate our pores, pimple pores, want to eradicate our patches, that dark patches, contraception, altering period cycle, that is your menstrual cycle. All these circumstances need drugs to be intended in our body and to act accordingly for doing all such things or all such mechanism in our body. Now, drugs, how we take, how it is being utilized, or how it works, we will learn in further chapters, in further episodes. First of all, the major term in which the whole pharma is divided is pharmacokinetics and pharmacodynamics. What is pharmacokinetics and dynamics? So pharmacokinetics means what how drug get inside our body. This is what pharmacokinetics, or we can say movement of drug in our body, movement of drug in our body is called as pharmacokinetics. And what is pharmacodynamics? What drug what drug does to body, or we can directly say the effect of the drug in a body comes under pharmacodynamics. Now, what is pharmacokinetics? How pharmacokinetics is being taken? So, how we can know the movement of drug in a body? Movement of drug, how does it takes place? First of all, when we take it in a GIT or through any source. For example, if we are taking any oral pill, so first of all, like this is a person and it's a mother of the person. Okay, so first of all, he is taking this pill inside the mouth. It will go inside the GIT through esophagus, then stomach, then intestine. It will go through whole the process, and after that it will circulate through portal, then it will come to liver, then after that it will go to the heart. After that it will come into circulation. When it will come into circulation into the blood, then it will start taken by the tissues, and then it will show its effect. Now, how it is being taken, so we have to understand the movement of drug from the outer environment till the internal environment, till um, the time when the when the drug is being taken or is being utilized. So we have to understand what is pharmacokinetics first, then we will learn about pharmacodynamics. Pharmacokinetics undergoes under four headlines. Those are A, D, E, and M. What is A? Absorption. What is D? Distribution. What is C? Excretion. What is M? Metabolism. So first of all, whenever the drug is being taken, it is first absorbed, then is being distributed, then it is excreted, and before that it is being metabolized in a body. These are the four steps in which pharmacodynamics is being covered. It includes four steps: absorption, distribution, excretion, and metabolism. Now, how this is being taken, let's understand it one by one. So, first of all, if we talk about absorption, what is absorption? As we know, what is absorption? So, drug, when the drug is being taken from cell barrier to blood stream, this is known as absorption. Now, how it will take place? So, for example, if we take any drug, it will go inside, then it will go through the esophagus, then the stomach, as I told, then the intestine. After then, through portal circulation, it will go to the liver, and then to the heart, and after then it will be pumped to the whole systemic circulation. Like this is being distributed. So here what we told, that from cell barrier to bloodstream, how it undergoes, how does it takes place, and what are the procedures that will take care of it. So as we have thought of cell barrier, as we have heard about the cell barrier, how the drug can be taken from outside environment to inside the cell, and after then to the blood. So first of all, when the drug has to pass through the cell barrier, we know what is the cell barrier, it is the membrane, and for passing the membrane it has multiple channels. And what are those channels? We have read about many transporters, we have read about many blockers, we have read about many channels, either it be ligand gated or it be passive, active, We have also read through diffusion, yes, the most common pathway through which maximum drugs are being absorbed. That is diffusion. Simple diffusion. Okay, simple diffusion. Now, those who will be lipophilic in nature will be absorbed through simple diffusion. Why? Because the membrane is made up of lipid. So if it has to be absorbed, so the drug has to be lipophilic. So our goal is to make the drug non-ionic or lipophilic or hydrophobic for being absorbed or to cross the cell barrier. Now it we got the idea that how we have to make, or how, what is the funda to make the drug available. Now let's learn about a bit about transporters and the cell barriers. So it may be of two type, passive and active. We have already learned from our 11th classes what is passive. Passive has two types. First of all, that is simple diffusion, and second is facilitated diffusion. It doesn't require any ATP, neither this as well. No ATP in both the cases. In this, no channels, but in this, channel is required. Active does includes many types in this, like we will talk about the examples, but it has channels, use ATP, yes, and in this, if we talk about the concentration gradient, here it will from high to low. And active, why it is being active and why we need active transporters to carry out low to higher concentration. Now we have learned the example of sodium potassium pump, very versatile, we can say most common example of active transport. We will learn more about this, about transporters. Let's give a quick review of transporters, the passive and active transporters. Okay, passive and active transporters. This will transport with the help of ATP. It is active. If no ATP is used, it is passive. Okay. Now let's talk about the nature of drug, that how it will act. But before that, there is one more protein, that is PGP. We can say P glycoprotein, which is an important kind of transporter, and we should need to know about its action. PGP, it has the role of throwing out or efflux of drugs from cell. For example, this is a cell and here is the PGP protein, this is P glycoprotein. So if any drug enters, it will efflux it out. This is the function of PGP. Now PGP, if it is present in kidney, what it will do? If we have to if we have to do the efflux of substances, what we can do? We can increase urine production. If it is in GIT, absorption will be less. If it is in liver, more bile production, isn't it? So by this mechanism, PGP works. Now there are types of changes that we can do, or two types of function that we can perform through PGP. First of all is inducer. We can induce PGP, and second is inhibition. We can inhibit PGP to do its work, to efflux. So induce, if we will say about inducer, that is PGP inducer, and second is PGP inhibitor. In inducer, what will happen? That the efflux will increase, and in this the efflux will decrease. For example, rifampicin is given with digoxin. So what will happen? That rifampicin is the inducer of PGPI, that is PGP inducer. Let's write it IN. PGP inducer, rifampicin is PGP inducer. So if digoxin enters the cell, the PGP which is being activated or induced, it will throw the digoxin out of the cell. So because of that, digoxin will not be accumulated in the heart cells. We can say the cardiac cells. Same thing, the PGP inhibits. Let's take the example of in PGP inhibitor, quinine. This will inhibit the effect of PGP, and if any drug is given with that, it will create toxicity which may cause arrhythmia. Quinine is anti-malarial drug. This is a function of PGP. Now let's talk about some pathological cases like of cancer, that about the cancer itself, which are having active PGP. Anti-cancerous drug. Let's talk about anti-cancerous drug. That here PGP is present. Anti-cancerous drug is being given, but due to the effect of PGP, it's being getting out of the cell. So the cancer cell is getting proliferated. Now PGP inhibitor is given. What if we inhibit PGP? If we inhibit PGP, the cancerous cells will take up the drugs, and the PGP effect will be decreased. So less drugs will get efflux from the cell, and the anti-cancerous drug inside the cell will do its mechanism, and by this we can reverse the action of cancer. We can't do it whole, but we can decrease the growth of cancerous cells. So that's all for today. Let's have a quick recap that we learned about pharmacokinetics and pharmacodynamics. What are drugs? First of all, we should know the definition of drugs, and pharmacokinetics, dynamics. What is pharmacokinetics? What is pharmacodynamics? Kinetics having it includes 4 headings, or we can say subheadings. ADEM, absorption, distribution, excretion, and metabolism. We learned about absorption, that when drug will be absorbed easily. Maximum drugs are being absorbed by simple diffusion, and there are some drugs who are lipophobic in nature. So how to convert them, and what conditions should be given so that they can be absorbed?